The patella and femur and tibia parts involved in articulation.
The word patella means little plate in Latin, but it is the largest of the sesamoid bones in the human body. It is located in the front of the knee joint, embedded in the back of the tendon of the femur. The patella is not directly connected with any other bone, but is held in place by muscle attachments. Together with the femur and tibia, the patella forms the knee joint, the biggest joint in the human body that supports almost our entire body weight. Interestingly, infants do not have an actual patella the way that adults do. Instead, to protect the knee joint, infants have a piece of cartilage protecting the joint between the femur and lower leg. Although all the bones start off as cartilage and become bones through ossification, most ossification occurs while the infant is still in the uterus. There is still some other bone development that occurs after birth, but the patella is one of the last bones to finish developing. This allows infants to fall, as they do frequently, without experiencing too much pain or injury because the cartilage absorbs much of the shock. The patella is flattened and triangular on the bottom and curved on the top. There are anterior and posterior surfaces of the patella, 3 borders, and an apex. The anterior surface of the patella is readily palpable and convex. What you cannot see or feel from outside is that the anterior surface is marked by numerous rough longitudinal striae, which are where nutrient vessels perforate the patella. A bursa separates the patella from the skin. The bursa is continuous with the superficial fibers of the patellar ligament. The posterior surface of the patella is divided into 2 facets by a smooth vertical ridge. This articulates with the patellar surface of the femur and the facets to the medial and lateral parts of the same surface. The lateral facet is broader and deeper than the medial facet. The facets and the ridge dividing the 2 facets of the patella is covered by articular cartilage. Thus, there is no true division of the articular surface, which really consists of 2 regions angulated with respect to each other. The medial condyle of the femur provides a point of attachment for the patella. The upper portion of the patella is covered by the infrapatellar pad of fat. The infrapatellar fat pad was traditionally thought to only have buffering and lubricating functions in knee joints, which can limit the knee's excessive activities, absorb shocks from the anterior knee, and reduce friction between the patellar tendon and the tibia. However, now recent studies into patella baja, a condition of having an abnormally low-lying patella, have revealed that the adipose-derived stem cells from the infrapatellar fat pad can biologically repair injured tendons when the patellar tendon is damaged. The knee joint is where the femur meets the tibia. The femur and the tibia are connected in 3 ways. First by ligaments, second by muscles, and third by the synovial capsule that surrounds the whole joint. The knee ligaments are the strongest connections between the femur and the tibia. These keep the bones from moving out of position. The synovial capsule secretes a liquid called synovial fluid. This looks like raw egg whites and nourishes the joint surface and reduces friction between them. If it is injured, it may produce too much fluid, called water on the knee. The patella rests in the trochlea, which is the articular portion of the anterior surface of the distal femur. The patella is able to move forward and backward. Without the patella, the quadriceps tendon would directly hug the joint, grinding back and forth in the groove of the trochlea, and would wear away with use. The patella holds the quadriceps tendon slightly away from the joint, protecting it and maximizing the tendon's function. The quadriceps tendon has an important function. When the quadriceps contracts, the tendon contracts, pulling the patella back. This pulls the patellar tendon back, which straightens out the leg. In addition to the quadriceps tendon and the patellar tendon, above and below the patella, respectively, there are 2 tendons that attach the femur to the tibia and that attach the femur to the fibula. These tendons help keep the leg perfectly aligned, adjusting every moment in relation to each other and the movement of the knee. If the patella does not have these tendons, it would be impossible to walk normally. Instead, the lower leg would be able to spin around. The patellar ligament or patellar tendon attaches to the tibial tuberosity. The tibial tuberosity is just below the lateral and medial condyles of the tibia and forms the terminal part of the tendon that acts as a lever to extend the whole knee joint. The tendon also prevents the knee from collapsing when the foot strikes the ground. The patella, femur, and tibia making up the whole knee joint acts like a hinge, but it can also rotate and move from side to side. The knee is more likely to be damaged than most other joints because it is subject to tremendous forces during sports and exercising. Most of the knee injuries that occur in sports result from twisting the joint. Patella fractures can occur from falling directly onto your knee. The patella may crack or break into pieces. These fractures often require surgery to heal, and over the long term they may cause arthritis in the knee.